Could you talk about the vaccine development and timelines? This person
Right.
states that many of the people they speak with will not receive the vaccine because of how quickly the vaccine was developed and rolled out to the public. So curiosity around if there was any step bypassed in the testing stage of this vaccine versus previous vaccines.
Yeah, so great question. And I've had that conversation with my own patients very, very often. First, let me go back to saying that the technology behind the mRNA vaccine and the AstraZeneca vaccine is not new. They've been doing mRNA technology since 1989. It was actually adopted by a group called the Coalition for Epidemic Preparedness Innovations, which is an international organization that prepares for pandemics as early as 2018. So we have the technology that is safe even before COVID appeared. Now, in terms of the COVID vaccine development, it still actually went through the entire process of new drug development. And the FDA has a very standard process for this. The phase 1 trials looking at safety, the phase 2 trials looking at effectiveness, and the phase 3 trials looking at efficacy at the real world level for a large group of people, at least 30,000 people. And so it did go through all of these phases in the appropriate way. What was cut down was the amount of red tape and bureaucracy between each of these stages, and also the way they analyzed the data. So in the past, when there was no hurry or when there was no pandemic and when people weren't dying in as great numbers as they were, the way that these studies were analyzed was the studies would be done and then the regulators would sit back and have a nice coffee and just, take their sweet time in reviewing the data after each phase of the study was done. Now, for the COVID vaccines, governments have mandated that the regulators actually review the data as they come in. And then, so think about like a typical bureaucrat regulator. They got the stack of paperwork that they have to review. The government has mandated that they actually bring the COVID studies to the top of their list. So that was what changed to make the approval of the vaccines so quick. No scientifically necessary steps were skipped to bring these vaccines to market.